Welcome to Enroll Wyoming, your guide to quality health coverage. We're part of the Wyoming Institute of Population Health, building bridges between healthcare delivery systems, patients, and communities across the entire state of Wyoming. What is the Patient Protection Affordable Health Care Act? Often referred to as the Affordable Care Act, ACA, or Obamacare. It's a way to lower healthcare costs to make coverage more affordable for individuals and families. It allows you to increase your ability to have quality health care available to all regardless of health. Today's presentation will give you an overview of the health insurance marketplace, job of the navigator or certified application counselor, how to get help. Our outcome, you'll be confident in who to contact, how to enroll in the marketplace, how to get further help, and we're not here for political forum. This is educational purposes only. Navigators can help you with education about the marketplace, provide impartial information, assist you with applying and enrolling, protect privacy and security of personal identifiable information. We will not retain your information unless you ask us to contact you back regarding an issue. The Affordable Care Act, or Obamacare as it's often called, provided specific components to try to make the healthcare more seamless. One of the components is pre-existing conditions. Many people were either cost prohibitive or prohibited completely from obtaining health insurance because of a pre-existing condition. Could be a heart condition, cancer in the previous or presently. Things like that would prevent you from having affordable insurance. Preventative care is included. You can go to your doctor and get checkups to find issues earlier on and make sure you're healthy and create a baseline. Prescription discounts are included for seniors. There's also prescriptions included in your policy. Many of the prescriptions are $2 or $5 for generic drugs, Tier 1, and discounts for other drugs in Tier 2, Tier 3. Benefits for women are included. We'll go over that in just a moment. Young children can be on their parents' policy up to the age of 26. It gave further responsibilities to health insurance companies regarding the amount of care that they pay for. And there's also a separate presentation we have regarding small businesses and the credits that they can receive. So health insurance is a way to get access to health care. Many people think, well, all I have to do is fall down in front of the emergency room and I get care. And that's true, but the care you receive is limited. It's focused specifically on that issue at that time, and they don't look at the overall picture and you don't receive the total care that you should receive. The health insurance marketplace is a website called healthcare.gov. Please note it's .gov. Do not reflex to .com. That's a completely different website which will immediately, once you give your information, start you with robocalls and pressured sales calls. Healthcare.gov is a marketplace, a place to shop for insurance with no callbacks. It's up to you. It's self-reporting to get this done. It's an online shopping experience that allows you to compare the plans a lot easier than going through a pile of papers. It has an educational component and compares things apples to apples. An essential health plan must have all of these as part of its component. If it does not have these, then it is not a qualified health plan, and you could be subject to a fine as well as paying your premiums. It must have all of these as part of its plan. Outpatient care. If you go into the doctor and you leave the same day, it's covered. Emergency services, hospitalization, so if you stay in the hospital, of course. Maternity care and newborn care is included. Mental health and substance abuse is included. And help with prescription drugs. Rehabilitation and habilitative is included. Laboratory services, preventative and wellness, and pediatric services including oral and vision care. Who can apply? You must live in the qualified health plan area, which in our case is Wyoming. You must be a U.S. citizen, Non-citizens who are lawfully present in the United States can also apply and must not be incarcerated. However, if you're preparing for discharge, it's something you might look into to get in place once you're complete. Cost assistance. Wyoming is one of the more expensive states to obtain health insurance, so the premium, or the amount you pay each month, can be difficult. If you're in a category, which I'll show you in just a moment, you can get help with making those payments. How do premium tax credits work? You receive a credit through your taxes in advance, so you're helping each month, receiving help each month with paying your premiums. You can receive all of it or part of it. You choose the level that you would like to receive. It's based on the income that you'll receive in the year that you're having the insurance. So let's say I want insurance in 2016. It's going to be based on the income you will make in 2016. A little bit of a guessing game. So as you progress through the year, if you're self-employed, in agriculture, change jobs, you will need to update your information in there to match your income. At the end of the year, there's an aggregate total. So you will look at the premiums you were paying, how much assistance you received in that, how much you were supposed to receive, and then they will deduct it. So then at the end of the year, you'll either get a credit or a debit. The idea is to keep it in track. So as your income changes, you make the changes. That way, at the end of the year, there's no surprises. Premium tax credit categories. This chart is a good way to understand if you're in a category to receive assistance. They call the chart the federal poverty level, and you can go online and look it up for 2015, the federal poverty level chart. And it's this chart here. It's based on family size. So if you have 1, 2, 3, 4, 5 people, however many people are going to be in your household on your tax return, that's the category you will choose. For this example, let's choose a family size of 3, mom, dad, child. The income levels to receive assistance are $20,090 up to $80,360. So if you're in that income bracket, you will receive assistance in making your monthly payments. Cost sharing is a separate component. The first part I was talking to you about are help with the premiums. This part is help with out-of-pocket expenses. For instance, your deductibles. It's a separate category that goes up to 250% on the federal poverty level. If you are a registered member of a tribe, it's 300% or less, and there's no cost sharing for you. This is a chart showing up to 250% of the federal poverty level. This category, you will receive assistance with the deductibles and out-of-pocket expenses. So let's go back to the family size of 3 again. If you're between $20,090 and $50,225 to receive assistance with the deductibles. The marketplace placed plans into metallic categories: bronze, silver, gold, and platinum. Platinum is no longer available in Wyoming. The bronze is the least expensive each month out of pocket for the premiums. However, it is the most expensive for out of pocket for the year. If you used your insurance, you will pay much more than if you did for silver and gold. I'll explain that a little bit more. If you received a silver plan, your premiums will cost a little bit more, but your out-of-pocket expenses for your deductibles will be less. And likewise, gold will cost more than silver each month, but then your total out-of-pocket and deductibles will be less. Silver plans are also especially important for those in that 100 to 250% cost sharing category. You must choose a silver plan to receive that cost assistance for the lower deductibles. What are the requirements for the ACA? If you live in the United States, you are affected by this. You will either have minimum essential coverage or you will qualify for an exemption, or you will make a shared responsibility payment. Minimum essential coverage includes all of those components in a policy that I showed you on that previous slide with the black and white pictures. It can be through a plan that you purchased outright, through an employer, VA, TRICARE, those kind of things. I'll go over that in just a little bit of what's available. But a complete qualified health plan. The qualification for an exemption, I'll go over in just a few minutes. So if it costs too much, you receive an exemption. You can apply for it. And then if you are in a category where you were supposed to have insurance in place and didn't, you're going to receive a fee from the IRS. And I'll show you what that is in just a moment. Who doesn't have to worry? Those who already have the minimum essential coverages, maybe through Medicare, Medicaid, CHIP, which is Wyoming Kid Care, TRICARE, Veterans Benefits, through your employer, or even COBRA. The plan can be grandfathered. That does qualify as well. Or if you applied for insurance through the marketplace. What is the penalty? Originally in 2014, the minimum penalty was $95 or up to 1% of your household income. And it's graduated up. Now at 2016, it'll be a minimum of $695. Very tight category to fall into that. It'll probably be 2.5% of your household income. Exemptions to the shared responsibility payment, which we talked about just a moment ago. There's automatic exemptions, so if you're incarcerated or not lawfully present in the United States, experiencing a short coverage gap of 3 months, live abroad for 330 days or more, income below the tax filing threshold, then you're automatically receiving exemptions. You're not going to receive a penalty. If you are in a category that you may be exempt, you may also be required to file paperwork. Those are if the cost of the insurance is over 8% of your income, tribal members, religious exemptions, and victims of domestic violence must apply for an exemption. Open enrollment is a period of time when you can obtain the insurance. Insurance is obtainable through November 1st through January 31st of 2016. If you obtain insurance during that time period, there's a slight delay when it becomes active. You can see the effective dates on the left-hand side of this column here. If it's outside of those dates, you must wait until open enrollment to obtain insurance. Unless you have a special event that happens in your life, you move, pregnant, change jobs, lose insurance, those kind of things, then you'll have a 60-day window after that triggering event to apply for coverage. Re-enrollment is a key issue. If you had a WinHealth policy, you must re-enroll by December 15th to have coverage starting January 1st. If you had a Blue Cross and Blue Shield policy, then you must re-enroll as well to help you prevent losing tax credits, update your information, choose the plans that are available the coming year. So it becomes very important to re-enroll and not rely on the automatic enrollment. How to apply? You can submit an application online, fill out a paper application, call an agent directly, call healthcare.gov directly, or call a certified application counselor or navigator, which we'll go over in just a few minutes. The information will be verified through data services, your eligibility will be determined, and then you'll receive a notice whether you can enroll in the marketplace or possibly if you would be eligible for Medicaid and you want to referral to there. Will be a filter as well through the process. What will be verified will be your personal information that is entered by you through the website, social security number, citizenship, incarceration status, if you're American Indian, Alaska Native, current household income determined by eligibility for Medicaid and CHIP, annual household income for determining your eligibility, premium tax credits, those kind of things. This is what the website looks like. You'll see that search window up on the top. It's a great place to click and ask questions and find information. If you want to see plans, you can click on the lower left column. That will allow you to either start the process or get an estimate of how much your insurance premiums will be. When you start the account, they'll ask you for your information, it'll ask you for questions. Be sure to write all this down and keep it in a safe place for your verification when you have to go back in and make changes. It does require you to have an email address, so once you enter this information, you will have to check your email to activate the account. This is the Marketplace website, the information that will come up with your personal information. Then it will give you a selection of plans. On the left is a plan that is outside of the cost sharing limits. So you can see the premiums are $211, deductible $3,000, out of pocket $6,600. If you're in that cost sharing category that we spoke of earlier, you're in the 250% or 100% area, look at the difference. You'll receive $74 for premiums, $1,250 for deductible, and total out-of-pocket expense of $1,500. So what's next? If you enroll in a qualified health plan, you'll expect a letter within a couple of weeks from your insurance company. You must make your first payment before the policy initiation date, or it will not start. Make sure you're covered by calling your health insurance company once you receive your information. Paying the monthly premium is directly to your insurance company. In Wyoming, the insurance company that's involved with the Affordable Care Act is Blue Cross and Blue Shield at this time. You can make your payments directly to them through paper check, money order, electronically through their website, or prepaid debit card. So where to go for assistance? You can contact us at Enroll Wyoming. You can go directly to healthcare.gov electronically, or they also have a phone number. Please follow us on Instagram, Facebook, and Twitter. And you can also call 211 for local help here in Wyoming. If you're on a bordering town, let's say Afton, you may get the other bordering states 211. Make sure it's Wyoming 211. They can help you. They're trained navigators there, and they can also get you in contact with other certified application counselors or navigators throughout the entire state. Once again, we're Enroll Wyoming, and here to help.